Okay, so the nurses just came in to check on me and everything, and I had a prescription for Valium because I have spasms in my hip and through my legs. So the Valium's supposed to help with the spasms. Um, Other than that, they were just checking to see why I constantly was getting blood draws because I had 3 in my hand, 1 attempt here, and then I don't know what that one was about, but they did it in a place where I told them that it would probably blow my vein, but no, I guess not. I don't know what that was about, but my wrist is like bruised all the way around. So.
And then your tummy shots.
Yeah, I'm on Love Knocks now because I have an IUD. So I get 1 shot of Love Knocks a day for 10 days. So tomorrow will be day 9. Yay. So
wait, are you supposed to like come in every day then?
No, they're gonna be sending some home, I think.
We get to just inject you in the stomach with it?
Yep.
That
I think so. I think.
That doesn't even make sense.
Why?
Well, I mean, so they're gonna give you like a take-home needle or something?
Or like prescriptions, and then we fill the prescription at CVS again.
Every day we have to fill that prescription.
I don't think it's every day. I don't know how it's done.
We'll have to ask, but that sounds ridiculous.
It's to help with anti-clotting.
I mean, I get what it's for. Because I remember them talking about it last night. I just think it's kind of ridiculous. That has to be so long. Hey, what do I know? Not just me.
They're also giving me steroids. I don't know what for. They told me, but I can't remember. It was probably like early in the morning when they told me.
Steroids last time too.
I don't know.
It's kind of like a customary thing.
Yeah. I think it's for the swelling.
It helps reduce swelling. Well, that's also with the Tylenol. The Tylenol helps reduce the swelling and the fever.
Yeah. So I get Tylenol. I get some sort of steroid. I get Dilaudid because Dilaudid's the only thing that really kind of works for my pain.
6 milligrams worth.
A lot, yeah. And then I get Valium for the spasms. Benadryl at night because I get like allergy issues. I don't know why, but I do.
It helps you sleep anyway.
It does help me
sleep. We're not going to
sleep.
complain about that.
Yeah, even though I've been sleeping off and on for like ever.
Well, you've been up since you've woken up. You've been up, so I think you're going to be up for a while.
We'll see. But we've been posting on Facebook. Mostly Devin's been posting on Facebook for me. So, I mean, other than that, I don't think we have much going on yet until I get to go sit in the chair, which will be interesting considering I have a Foley cath on one side, and on the other side I have like this hemo drain thing. So, we'll see. Maybe Devin will record for that part as well when it comes up. Yes, show them the drain. That's the hemo drain. It's attached to my side down there. You can see it where the bandage is, and that's the ice pack wrap. Because the ice machine is down there. And then the Foley cath is over here somewhere. I don't want to move it because it feels weird.
Where the catheter is?
Here's our room. That's the door.
The door's back here.
There's
Your
the
catheter
computer.
runs down here and empties into this.
The bladder.
Yeah, down here.
And this is what I get to look at. That's our thing. For the tells us who's working with us for the day.
The person peed a lot, I think.
And then that's our lovely view out this window.
Not as good as the last one. Last view was way better.
Yeah. So it's about almost 11. It's 10 till. So we'll see when they come in. When I get to go sit in the chair. If I get to sit in the chair, I still have the epidural in. So
You sat in the chair last time with the epidural.
it's just weird though.
It doesn't matter.
I know.
You put a shirt on.
I was on a lot of drugs and a lot of pain.
I know, and I'm not saying
like
that. I'm not arguing
act
that.
like a crazy person.
But every time I mention you putting normal clothes on, you're like, no. When you got done with the surgery and you came back to your room, the very first thing you did was put pants on. And then you wanted a shirt on. And you had epidural in, you had all this stuff in. And you still did it. So I mean, if you're gonna sit in a chair, you'll be fine. Because she's gonna move that chair over there. So you're just gonna get out of bed and into the chair.
Yeah. Oh.
You're not moving away from your bed.
No, but you'll have to record that part so that we can put it in the video for today since it's day 2. It's day 1 post-op, day 2 in the hospital.
I know.
And then we'll post this video.
We'll get it.
So, we'll see you guys in a little bit. Okay, so, my dad came to visit me at the same time physical therapy came in. They were trying to get me to stand with the walker, but my legs are so weak from the epidural that I really couldn't do too much, and it kind of gave me quite a bit of pain, so they gave me some meds, and I've kind of tried to relax here, laying on a little bit of an angle towards my left side, and it's just really, I'm just super sore, but I think most of my weakness is from the epidural. I think I just said that a second ago, but I'm tired, and after I get something to eat, I'm probably gonna fall asleep for a little while and see what happens from there. Devin brought in my crutches and my brace, so we're good to go whenever I need to use those, which I think we're hoping on getting that epidural out tomorrow, just to see what happens. I mean, I don't see why technically I would need it now, and it's numbing everything else other than my hip, but we'll see what happens. So I'm not going crazy. It's just been kind of itchy on my back and everything, so we've been trying to work on that as well. But I guess I will update you guys a little later. Okay, so my dad came to visit me at the same time physical therapy came in. They were trying to get me to stand with the walker, but my legs are so weak from the epidural that I really couldn't do too much, and it kind of gave me quite a bit of pain, so they gave me some meds, and I've kind of tried to relax here, laying on a little bit of an angle towards my left side, and it's just really, I'm just super sore, but I think most of my weakness is from the epidural. I think I just said that a second ago, but I'm tired, and after I get something to eat, I'm probably gonna fall asleep for a little while and see what happens from there. Devin brought in my crutches and my brace, so we're good to go whenever I need to use those, which I think we're hoping on getting that epidural out tomorrow, just to see what happens. I mean, I don't see why technically I would need it now, and it's numbing everything else other than my hip, but we'll see what happens. So I'm not going crazy. It's just been kind of itchy on my back and everything, so we've been trying to work on that as well. But I guess I will update you guys a little later. Hey, just PT came back in. I'm now actually sitting up in bed. Woo.
This will be your second time sitting up in bed.
This will be my second time. The first time I hurt a little more than right now, and right now I'm just kind of sitting still the way I am to just make sure that I don't shift too much on that hip, because it's still pretty sore and everything. But not only that, Devin put lotion on me and it felt amazing.
Well, I had to. Because I love you.
And I'm letting the tubes drain where they need to go and see where we go from there. PT will be back. I still don't feel like I could stand very much because of the epidural, but
well, again, I don't
hopefully first thing in the morning I get it out and we can try again.
I don't think it's all the epidural either. I think it's I think it's not just the epidural. I also think it's the fact that both hips
were messed with.
You don't have that extra one that you could put all the weight onto, Whereas last time you were able to do that, you can't do that this time. So
yeah.
It's a little more paced, which is good.
And I'm a little more coherent.
You are. You're not as doped up as you were last time.
Yeah, that was pretty rough.
Last time you were really medicated.
Yeah.
And that in
do you
turn...
have... Did we already show the screws on camera?
Yeah, I mean, we can do it again.
Yeah. I'll show you guys my screws. Fun. These are the 4 screws that I had in my left hip. And I guess I get 1 more extra of these in my right one now.
Yeah, there's 5 in your right one.
Yeah, so...
And they,
it's pretty rough.
It's got that flat out, so that way it,
evens the degree of my dysplasia.
Yeah.
Sorry, I just dropped you guys. Hang on.
That's my hand. More of my hand. Did we flip it?
There. We accidentally flipped it.
There.
It's okay. I just kind of...
I gotcha.
I kind of dropped the phone on that part, but...
I'll be the cameraman. Somebody's been Benadrylled, so...
I have been Benadrylled again because I was itchy. And that kind of helps, especially because it helps me sleep too. So... I think we're doing good.
I think so too. We got the catheter bag.
And then
People can see Jen's knee. Look at Jen's sexy knee.
This is a wound drain.
There's Jen's wound vac, or drain, I should say.
Yeah, it's all gravity. It kind of pulls in from a spring inside here.
It suctions. Those are trying to avoid certain spots. Those are the things that help keep circulation to the legs.
So I don't get blood clots. And I also have these new lovely stockings because they think that pre-diabetic means diabetic.
Yeah.
But it doesn't. I'm not diabetic. I just had high insulin levels the last time I saw my doctor, and I guess they're just taking super extra precautions.
Hook up to this machine here.
Yeah.
And that gets the circulation going, and back at Jen. Jen, we've gotten a lower dress shot, sorry.
Not that low.
It's okay, you couldn't see anything.
But
hey, this is YouTube, by the way.
yeah, well, I'd rather not be porn tuned at this point.
And Jen's got her sense of humor. You can edit that part out. How's that?
No thanks.
You're welcome.
But yeah, so
Then we got Jen's lovely machines there.
this one actually hooks up to the epidural. It's got the medications in it.
That one's from Satan. This machine is from Satan.
It's not that one anymore. They shut off that
Oh yeah, it's not that one anymore. They delivered us from hell, and they put us...
I had to wear like a certain type of nasal cannula that they didn't have to put oxygen through. It registers my CO2 levels because of the epidural. But since the doctor came in, he said that we could just take it off. And that was awesome to do because that thing was really annoying. Even if you move and it comes out of your nose just a little bit, it starts pinging that alarm. So.
Do you feel comfortable showing, like, where?
Right here. This gray part is actually the ice machine. And then the wound vac comes up and through here. And then this is where the incision is up in here. So. Then I have no idea about this side, so. There's like a clear bandage under there where they remove the screws.
Right there's the waterproof bandage that covers the incisions. So she can actually bathe with this on. And that probably won't come off for 2 weeks. The same as on the other side, but it's more covered because that's, you know, the more dominant cut. Yeah. And then, of course, this is, again, is the band for the Iceman.
So.
Oops, sorry.
It's okay.
I kicked you.
Eh.
You can't feel it anyway.
I can feel it. It didn't hurt me. But yeah, so we're getting there. A little bit closer to getting up. They brought a walker in for me to use. I already have one at home. And then we also brought the Moby leg.
The Moby legs will
for
come
tomorrow. Hopefully I can get on those as well.
Come with the cameraman. get you over to the here. So you've already seen the brace, which is in the package, but Obi legs. We'll take one over here so Jen doesn't need to get up. Alright, again, sorry, we had a problem. We had a little problem there. We do everything off the phone, but this is a movie leg. It's a crutch, essentially, but better than crutches. It's got the swivel.
It swivels, like,
and then the
this
grip
makes it
right
really
there.
comfy to balance on and everything.
Very soft grip. And of course, she's got it custom designed.
I did put stickers on it.
And then it'll even tell you what leg it's for.
Yeah, you have one left and one right, and they balance a little differently. That's why they have them labeled that way, because they're a little bit different. Each one is different from the other. So.
So she's all set up, and then she's gonna be borrowing my old man's wheelchair for a bit.
Mm-hmm.
But she'll only need that for maybe the first week at best. But
well, we'll see what happens.
yeah, we'll see. We'll see how that goes. But for now, that's pretty much it. It's Jen day 2, PT.
Yeah, PT day 1.
PT
So,
day 1.
Guess we could end this video and then we'll do another one tomorrow.
Or if anything eventful happens later tonight.
We'll let you guys know.
Yeah.
So.
Bye bye.